Welcome to our next edition of TIKES Tips. Thanks for joining us today. My name is Ginger Hisaw. I'm a mental health consultant that serves Central Louisiana. Today's topic is one of the most dreaded behaviors in toddlers, and that is biting. So the first thing most definitely to remember is that biting is very common among toddlers. I was a biter. Although it's typical, it is not acceptable behavior. So the first tip in biting prevention is to know that all biting happens for a reason. It can be very helpful to figure out why so you can figure out how to help. So our second tip is to use a solution that is appropriate for the reason for biting. Biting a toddler back is never the answer. We definitely don't want to reinforce a behavior we're trying to stop. So let's talk about the common reasons that toddlers bite. The first one is frustration and stress. Toddlers need our help dealing with their emotions and need help in developing coping strategies. So things like having a predictable routine and schedule, making sure toddlers get adequate sleep, having a cozy area to relax. Secondly, toddlers can bite because they're having teething or dental pain. Providing things to soothe when teeth are coming in or giving them a crunchy snack between meals can help. Cause and effect. Biting gets a reaction. Little ones don't fully understand that biting hurts, but it definitely gets our attention. That can be reinforcing. So find other ways to connect with your toddler. Play is a great way to do that. Unawareness of others' feelings. Toddlers may see others as objects at times and don't fully understand that bites hurt. If a bite happens, calmly and firmly use words to help bridge that connection. For example, you bit Tommy, see his face. Your bite hurt Tommy. Tommy is sad. Try to give a short, unemotional response. We definitely want your child to have empathy for the child that was bitten. Challenges in play. Before 2 years old, children do not interact and play with each other. They play beside each other, but not with. A toddler may bite to retrieve a toy or because there's a challenge in the play. If a toddler bites and retrieves a desired toy, you're strongly encouraged to retrieve the toy as quickly as possible so that behavior is not reinforced. Children need our help learning play skills. You are the best person for that job. They can learn so much from you. Some toddlers will bite because another child invades their space. Help your toddler learn short phrases like move back or too close. And you can also speak for your toddler. Tasha says, move back please, or Sarah says you're too close. Imitating others. Toddlers may start biting because they have been bitten. So our third tip today is respond with what works. Create a safe space between the child who bit and the child who was bitten. Let the child who bit see you provide empathy and care for the child who was bitten. Avoid demanding an apology. We most definitely want children to learn to apologize, but we want them to learn to do so when they really mean it. And also avoid making children hug after a bite or an aggressive behavior. This goes our natural human tendency to avoid or be cautious of people who've hurt us. Shadowing a child who is biting can help prevent the bite before it happens. In a nutshell, shadowing is staying close and intervening as necessary to stop and redirect a child. Finally, sometimes additional support is needed. If the biting gets worse over time, or if a young child is biting themselves, seek support from a mental health professional and your child's pediatrician. Thank you for joining us today.